Good evening, everyone. So, today we are again back on our live session. So, today's session is on breastfeeding myths. In my clinical practice, I see a lot of breastfeeding myths which are prevalent in our society. But today I am going to speak about most common 10 breastfeeding myths which I usually hear from people. My name is Dr. Tanima Singhal. I am a lactation consultant, childbirth educator, and a Garbh Sanskar expert. I have 12 years experience in OBS and Gynae. My graduation is in Ayurveda and post graduation in reproductive child and health. Since 3 years, I am practicing as a childbirth educator, pregnancy educator, a Garbh Sanskar expert, and a lactation consultant at Maa-Si Care Clinic, Vikas Nagar, Lucknow. I do take online consultations also. So today, first breastfeeding myth which we are going to talk about is women with smaller breasts, flat nipple, inverted nipples will not be able to produce enough milk for the baby and they cannot breastfeed the babies. This is not true. This is a myth where people feel this way. So, why it is there? Because the size of the breast does not matter. It is the breast tissue which makes milk, and there are sufficient amount of cells which produce milk. Second thing is about flat nipple or inverted nipple, because people feel that if the nipple is not properly formed, then the mother will not be able to breastfeed her baby. But this is not true, because whenever we are trying for breastfeeding, we always say breastfeeding. We don't talk about nipple feeding. So the baby has to be latched on the areola of the mother. So if the nipple is flat or inverted, it doesn't matter. So the mother has to always keep her confidence high that she can breastfeed her baby. Second thing, it is normal for breastfeeding to hurt. Many times when the mother come to me and she tells that during breastfeeding it pains, and she says that I was told from my family members or my friends that little pain is okay. No, you should not have painful breastfeeding. Breastfeeding should be a very good experience, and it should be an enjoyable experience for the mother and for the baby also. If the breastfeeding is painful, then you have to check for latching. It is almost due to a shallow latch that the breastfeeding hurts. So, how you will ensure about that? If the mother works on her latching and the hard palate of the baby, when it gives pressure on the soft tissue of breast of the mother every 2 hours or 1 hour, or whenever the mother is feeding her baby, it will cause lot of pain, and sometimes it also causes sore nipples or cut nipples. Even the nipples start bleeding also. So we have to always see that the breastfeeding is not painful. So for that, a deep latching is most required, which is important for a painless experience. Third, you will not produce enough milk during first 3-4 days. This is a very common myth which mothers usually have, that I will not produce in milk in the previous initial days. So again, this is not true. You have to always remember, in my previous sessions also I told you, if the baby is put to breast frequently every hour, every 2 hour, and the baby is made to suckle on the mother's breast, it will ensure a good milk supply. And in the initial days when the baby is born, the stomach capacity of the baby is only 8 ml, 8 to 10 ml. So what happens that the initial colostrum which comes, which is a very thick yellow colored liquid, and it is full of antibodies, that the amount is very less, but that is sufficient for a baby. So you have to always ensure, and always just give confidence to the new mother that she can breastfeed her baby, and the milk which she is producing is sufficient for her baby. For yes, one point to be noted, that the mother has to always ensure that the baby is gaining weight properly. For that, you can consult your pediatrician and they will tell you whether the baby is gaining weight properly. And if the baby is not gaining weight properly, you should ensure and you should see that the latching is deep. Now, next, fourth one is your nipples should be washed before every feeding. This is most asked question by mothers, that they feel that after every session or before every breastfeeding session, they should wash the breast and nipples. So it is not required. If you do it frequently, it will cause the protective lubricating oils to get washed away. So it will cause dryness of breast, and it is not good for the health of the skin. So it is not required to wash the breast before and after every session, every breastfeeding session. Next, breastfeeding is akin to natural conception, or mother cannot get pregnant if she is breastfeeding. This is again wrong. This is a myth. People feel that when the mothers are breastfeeding their babies, they will not get pregnant. So this is again not true. When a mother does not get periods during her breastfeeding journey, it is called lactation amenorrhea, but that doesn't give you protection against pregnancy. So if a mother is breastfeeding her baby, there are certain conditions like exclusive breastfeeding, not even a single any other liquid should be given to the baby, but still then also it is not 100% proof formula that you will not get pregnant while breastfeeding. So if a mother is breastfeeding her baby, she should not like just leave everything that I will not get pregnant. So you have to just talk to your gynecologist and see what mechanisms or what things you can follow not to get pregnant again. Next, modern formulas are similar to breast milk. So again, many people feel that these days formulas are very good and they are equivalent to breast milk. No, this is again not true. You have to always believe, you have to imagine the formula companies which are making the breast milk formulas, they are trying to imitate breast milk, but they do not contain any living cells. There are no enzymes, antibodies. Breast milk can change to the changing needs of the baby. It suits the needs of the baby, and it is a tailor made milk, while the formula milk is the same kind of milk for every baby. It is not made according to the, it does not suit according to the baby sometimes, and babies sometimes have lot of issues with the formula milk. So it is not at all equivalent to breast milk. You have to always remember that breast milk is best for the baby. And a few days ago I was told by one of my friend that there is a lot of lot of information about adult breastfeeding also, and it is becoming popular day by day. And around a week before, I was contacted by a family. They wanted to start breastfeeding, they wanted to start relactation for their 4-year-old child. So you can see that the mother was very like she knew about adult breastfeeding and she wanted to breastfeed her baby who is 4 years old. So we have to see that okay, breastfeeding is very important and the world is recognizing the efforts, and mothers should please ensure that they should breastfeed their babies. Adult breastfeeding is becoming common and we have to ensure that our babies are getting our breast milk very earlier than anybody else. So babies have their whole right to have their mother's breast milk. Please ensure, every mother should ensure that they should give breast milk to their babies, and as a society it is our work, it is our duty to support each mother. Next myth is nursing should be stopped if the mother has infection. Okay, so now this is again a very common myth where people feel that if the mother is having fever of any kind or any infection, she should not breastfeed her baby. No, this is not true, because when a mother is exposed to any kind of infection, the antibodies which she is making, they are passed on through the breast milk to the baby. So that will give antibody protection to the baby and will always it will keep the baby safe from the infections, and the baby will not have any other issues. Even for COVID-19, breastfeeding is safe, entirely safe for the baby. So we have to always see that the breast milk is made regularly ensured, and we have to ensure that the mother continues breastfeeding to her baby. Next myth is exercise could lead to sour milk. Many people feel that exercise will cause the milk to go sour, or it will not make a good quality milk. Again, this is a myth. With a good exercise regime, a mother will have good endorphins secreting into her body, which will lead to her good health. So, in that way, there is no any such problem that the milk will become sour or something. So, this is again a big myth that exercise causes the milk to become sour. Next myth is a pregnant woman cannot continue breastfeeding. Again, this is a myth. If a mother gets pregnant while she is breastfeeding her baby, she can still continue breastfeeding. There are certain medical conditions where she can discuss this with her gynecologist, like premature delivery pains and all like that. You can discuss with your gynecologist, but yes, you can continue breastfeeding if you are pregnant. Also, if your baby is born, you can continue breastfeeding to your newborn and to your elder child also, and that is called as tandem breastfeeding, which is not at all uncommon. So you have to always remember you can breastfeed your both the babies of the different age groups if you want, if a mother wants to breastfeed her both the babies. So you can talk to your gynecologist once if you are pregnant, and after your delivery you can continue breastfeeding for both the babies. The last myth is you should only eat plain food while breastfeeding. So again, this is a common thing which I always discuss. Breastfeeding should be an enjoyable journey for a mother. It should be a pleasant experience. If there are a lot of do's, no don'ts for the mother, not to eat this, not to eat that, and lot of times mothers are so confused whether I should eat this, whether I should eat that. So always remember, moderation is the key. You can eat whatever you want to eat, but it should be in moderation. So, mothers, please don't worry about any kind of thing that you can't eat this or you can't eat that. Moderation is the key. You can continue breastfeeding your baby with whatever you want to eat, but it should be in moderation. So, like a lot of people ask me, what are the foods to avoid while breastfeeding? So, I always tell the mothers that instead of knowing about what are the foods to avoid breastfeeding while breastfeeding, you should continue breastfeeding your baby and eat whatever you want to eat, but yes, always eat it in moderation. Always think that this food will cause what kind of health to me or my baby. If you are conscious about what you are eating, what is going inside your body, you will obviously not ever any mother never wants to have any kind of hurt to her baby. So that way a mother will be responsible about what she's eating, and it will not cause any kind of pressure on her which will cause any kind of problems to her. So we have to always ensure that the mother has a very pleasant experience during breastfeeding. So these are the 10 myths which I wanted to share with you all. If you all like the whole session, kindly please like it, share it, and please tag your friends so that this kind of awareness goes into our society, because we all need to make ensure that our babies are getting the breast milk of their mothers. Thank you so much. This is Dr. Tanima Singhal signing off. Take care. Bye bye.